So welcome to our next Lifelong Care podcast. It's been a while since the last one, but I'm Charlotte Routh, I'm one of the Lifelong Care leads, and I've got Eliot Sykes, who's also one of the Lifelong Care leads here. And we're planning today just to give you a little bit of an update about where we are with our overall lifelong care, and just to be mindful that the last one we did was May 2024. That was the start of our series, and subsequently Eliot's got out of doing any more, and I've done a number around some different themes, but we thought we'd just update you on where we're at and what's happened and what our priorities are moving forward. So our commitment is still the same. We've not changed that at all, which is around delivering personalised, timely and compassionate care and helping people to live and stay healthy for longer. That's been our overarching principle throughout, and that hasn't changed. But what we've been working on is a cultural change and getting people to understand lifelong care as a concept, and embed that within the organisation. So what progress have we made so far? There's a lot, isn't there?
There is. I think the more and more people we talk to, and we talk to a lot of people, the language is more familiar. They talk about watching the podcasts, the triangle, etc. So we're definitely moving in the right direction. I think that cultural shift feels palpable now. It's a journey. It will continue to need lots of work. We will continue to evolve. We can never communicate enough about this, hence doing the podcast today in part. But we've definitely shifted the dial, and that's as much people telling us that as the impression that we get. Yeah.
And I think it is hard for us to look back, isn't it, from where we've come from. We've been on a massive journey already where we were on whiteboards in an office trying to brainstorm about it, to actually now having great working groups, people coming to us with ideas, showcasing stuff, which is great. So I think one of the great things that we've seen is the patient charter coming on board, isn't it?
It is. I think there are two aspects to say about the patient charter. It's a fantastic piece of work. We've now got a document which, in language and principle terms, really starts to reflect what our patients want out of healthcare. But secondly, it's the way it was developed, and the importance, if you like, that the lay sort of representation and the patient participation group have now started to afford us. They're a really important and powerful voice and influence within the project now, and I really think that we're starting to demonstrate that we've got strong co-design. So medical staff working with patient representatives in parallel to producing something that's much more meaningful from a patient perspective.
Yeah, and we have two representatives that work with us in lifelong care, and it's great to have their involvement, and they keep us on our toes, and they ask the difficult questions, and
they do.
That's really important.
They ask questions that we commonly wouldn't think about. As you say, they keep us agile, they keep us on their toes, they challenge us, they probe us. So they really have afforded us a lot of benefit. Yeah. I think the other thing I would say about the patient charter is, I see Northumbria as, I describe it as a bit like a stick of rock. You break it at any level. You can see what pervades the organisation from a cultural perspective, and you can see the patient charter starting to sort of infiltrate, if you like, that stick of rock. It's entering parts of the organisation which heavily influence our thinking, our language with patients, and our culture and our behaviour.
And I think it's great how much work has been done on it. We obviously had Joe and Judy, one of our lay reps, come to a previous podcast, but I think people now want to think about it because it feels right, doesn't it? It absolutely feels right.
It makes a lot of sense once you read it on paper.
I think one of the areas that we've been quite successful around influencing the strategy is frailty, isn't it? When we first met the frailty teams, they were very different. They worked within the community, they worked within the hospital setting, and what we've seen is them coming together to work as sort of one group together.
I think we have. So I think they have come together. They're talking about a different and a new vision, but it's not just about the sort of traditional frailty team coming together. It's about them working with different parts of both the organisation and the healthcare landscape. So, there are a number of projects since we last met which we should highlight that are really starting to make a difference. So to our urgent community response, the care home project, the integrated frailty model, call before convey. These really are starting to try and strike at the heart of the charter, what patients want, trying to keep people healthy at home for as long as possible and try and avoid them coming into hospital.
Yeah. And I think all of those are a really good example about working with stakeholders outside of the organisation. You know, the care home project, identifying the need, working with the staff within the care homes, helping to support them to manage risk. It's been great seeing that evolve. So,
that's right.
And that team is so passionate, aren't they? The frailty team.
They're
really passionate.
And it starts to get into the realm of what we may talk about later in terms of neighbourhood health as well.
Yeah, and our public health team are keeping us on our toes. So we saw Jill in a previous podcast, but actually it's really important, isn't it? Because this is about our population. This is about thinking about health differently and preventative medicine. And we've seen some really great work coming from their teams as well.
We have. And I think they continue to add to different parts of the project. So we've seen great pieces of work, partly about the charter, partly about working into prisons. Continue to see great work within outpatients around navigation and missed appointments. So again, they're just spreading across the project and across the organisation and informing our thinking and our education on public health topics as well.
Yeah. And I think that we call that MEC, which is making making every contact count. That was a term that a few years ago people didn't understand, and now so many of the staff have been on the training, understand that every contact they make with a patient shouldn't just be around what they're there for. It's about the bigger picture.
That's it.
I think that's really nice to see people. That's a real cultural change as well, I think. So, and we're starting with children and young people. There's lots of great work going on in maternity and child health, and we're just trying to tease out a little bit, aren't we, how sort of children transition to become adults and how they develop and what we need to think about in terms of educating them about healthcare, but also thinking about how they might be accessing things differently.
So we have, and if we're honest, we've discovered early on that there are lots of things we could do better. And, you know, we're not currently managing patients who are transitioning from traditional children's and paediatric models into the adult models, so there's definitely work to do and opportunity there. I think it's also important to say and recognise that in looking at this area, it is a reflection of one of our thought processes around the project needed to become more lifelong. We recognise that to a degree we're a bit skewed and focused towards adult patients and the elderly and the frail, and that's correct because they consume a lot of our healthcare. But equally, we need to focus on the best start in life, children and young people, midlife, along with late life, last year of life, etc. If we have that true population benefit. So it's been really important.
I think there's some real opportunities there as well. Both me and you are parents. We've got children who are into those adolescent years and becoming independent young people. And actually we hear so many stories and there's learning around that, isn't there, as well, where you know, that might be their first contact with healthcare. It might be they might have already been in healthcare for a long time, but actually they've got thoughts, they've got ideas, they've got experiences which we can learn from as well.
Absolutely. And on that point, and going back to the comments about the patient charter and the lay patient representation group, I think it would be fantastic if we could get representatives from that group. To sort of help us in terms of their voice and designing pathways and services in a correct way.
Yeah, and I know that's a real priority for the sort of the patient charter group to move things forward and recognise that sort of cohort of people. So you talked a little bit about moving care into the community and our stakeholders outside. You talked about neighbourhood working. What does all of that sort of mean to us and mean to the organisation?
Yeah, so there's a lot of new language floating around. So we hear about the 10-year plan, we hear about neighbourhood health. It's a bit daunting to people, so it's probably helpful just to help people understand. So the 10-year plan is clearly an ambitious, large document. Fundamental principles are about analogue to digital, hospital to community, and sickness to prevention. But fundamentally, it's about delivering care in a different way. Ideally out of the traditional hospital environment, keeping people in their homes for as long as possible, as long as possible, and then when they need to come into hospital, they come in the right way and have really good access. And I think that's a lot of what we talked about, and it's also going back to our pyramid about how we move up the pyramid. I guess neighbourhood health is a vehicle, if you like, within that. It's essentially a way of bringing all the different parts of the health and social care system together to think about working differently, if you like, break down those traditional structural boundaries of hospitals, GP practices, etc., and just think about working and interacting in a different way.
Yeah.
And I think within that, it's just really important to remember that a lot of this is founded on relationships and trust.
Yeah.
And I think you and I would say that over the last year, particularly, all the different meetings that have started to happen with different people in the room together, we're building those relationships.
Yeah.
Those faces are becoming more familiar, as are the conversations.
Yeah.
And out of that comes strong ideas, new ideas, and ultimately innovation, which is key.
And we've had some great stuff just recently, haven't we, about Lintonville and new hubs opening up there, and they surveyed people about what they wanted in those hubs, and that was really interesting about what the local community wanted and felt they needed to access. And I think it'd be really interesting to see how that work goes forward, because asking people what they want and what they need in local communities is sort of the heart of neighbourhood working, isn't it? So, yeah. And when the sort of the NHS 10-year plan came out, it's daunting for the organisation, it's daunting for the sort of the country really, but actually we felt quite positive about it, didn't we? Because we felt like we were a little bit ahead of the curve.
I think we did. I think we feel quite strongly, and as do others, that in the last 2 years we've really shifted our language, our thinking, as we've described, and effectively provided ourselves with a really strong basis and platform to move into these new discussions in terms of the 10-year plan and neighbourhood health. I guess the other point, though, is it's new and it feels big, it can feel daunting, and I think our approach is let's just chunk it up, approach things in bite-sized chunks, be realistic, but also acknowledge that some of these things, because as we repeatedly said, involve significant cultural change, will equally take time and in some cases traverse multiple years.
Yeah, I think that's right. And actually the digital thing's interesting because we have what we call enablers to lifelong care, and the digital team is one of our enablers, and it's been nice to hear them come back and update how they're helping the work streams and how they're listening to what we're saying and where people are struggling, because actually digital comes up at every single conversation, doesn't it, as a sort of barrier or a challenge to people. So. Yeah,
it's on the tip of everybody's tongue. It's definitely an enabler, both in terms of how we communicate with different parts of the system, but also, most importantly, how we share information as well.
Yeah, and I think our digital team have been really open and fantastic, So we have a few priorities going forward for the next year, don't we? One of those is becoming lifelong, which you've already talked about, and we've just had a World Cafe for young people in December, which was great, and hearing from voices outside of the organisation, and we're going to try and take some of that work forward and really drive that young people's work. The other thing that we wanted to do is think that our lifelong care was aligned with the overall strategy of the Trust. So, I mean, it's difficult for people to understand what that really means.
Yeah, so you'll hear people using the word strategic alignment. It's in many ways, it's a fancy way of saying, let's look at our Trust values and principles, ensure that the project is aligned to those, and then ensure that the work streams and the bits of work we're doing within the project are aligned again. And ultimately that filters right down to the sort of ward or patient interface area. So ultimately it's that common thread, if you like, and common language from the sort of boardroom, if you like, to the project and to the clinical space. And it's absolutely key in terms of consistency, understanding, and ultimately ensuring that we deliver the care in the new way that we want to.
Yeah, it's important that people understand the Trust values and the big signals and the lifelong care, and they can put it all together and understand the differences. But also it's important because in changing the way that we look after people, we're also going to have some shift, aren't we? Whether that's with workforce, whether that's with money, whether that's with estate. So it all needs to join up.
It does.
Because there's some difficult conversations that go on around that. And we talked a little bit about it before, but also organisational processes have started to really think about lifelong care as well. So we've seen it come into recruitment, induction, and interestingly, this podcast has been watched by, will be watched by people who are coming into the organisation. We've heard that people watched our previous podcast before they came to interview, so that's great. But also we've seen the education and training teams thinking about it, and actually the quality panels have now changed and how we think about it, and we've asked them to align what they ask clinical teams about in terms of lifelong care, and that's great as well. So
it's absolutely key. These are key touch points in the organisation that influence people's thinking, behaviour, language, and ultimately our culture. And it's absolutely brilliant and essential that the Lifelong Care Project, its principles, the patient charter, infiltrate these parts of the organisations to create that shift that we keep on talking about.
Yeah. And at the end of all of this, people still have to deliver on projects, don't they? And we're sort of there to help and influence and make them connections and everything else. So what do we want to see in terms of delivery of people's projects and things?
Yep, so some of the delivery is the cultural shift, the language, the mindset change. Ultimately, we would traditionally measure success by measuring things. I think that's been a challenging topic for us, partly because we will naturally default to traditional measurements, and they are maybe not as applicable in the lifelong.
Performance related, aren't they?
Yeah, that's it. So I think we've grappled with that. I think the neighbourhood health pieces of work and working with other people from different parts of the system will help inform this discussion. I suspect it will become more patient focused and patient reported outcome measures and more patient centred, which does align to the principles that we've discussed. But I think if you and I were both honest, we'd say that piece is a sort of work in progress, if you like, really at the moment.
And actually, I'm involved in a project where we're throwing the patient experience questions on their head and actually making them more about the patients. And that's really interesting too. That's really pushed the barriers of thinking we used to ask the patients about things that we wanted to know rather than what they wanted to tell us or what was important to them. And again, looking at that as an outcome is going to be really interesting as that embeds. And there's a challenge really as well, isn't there, around the 10-year plan and the political landscape that we could think a lot about, couldn't we? But actually, this is about what's right for our patients, and it's all falling into place. It is,
but as I said, and you've said earlier, let's stick to our principles, the charter, our trust values, the principles of the project, ensure they're aligned. We've got that strong basis. Let's remember we've got a really strong Northumbria way, strong culture. Let's just chunk it up, tackle it bit by bit, collaborate in the right way, and I think we'll succeed as we always do.
Yeah, I think we will, and I think we've summarised quite nicely of where we're at as a team and what we're seeing within the trust going forward. And really, we still want to hear from people. We want people to come and talk to us. We want them to be involved if they don't know about it. Look at the websites. Those are available on the intranet and the internet. And you can email us too. The details will be put on the end. For those working within the trust, we've got an event coming up with a plan to share examples, haven't we, in May? And I think that would be great. Our events previously have had loads of energy around them. They've even been quite emotional at times that people have shared their work and their stories. So I think we're really looking forward to that event happening in May. And just to wrap up, we have another couple of podcasts. We've mentioned a few things that we think people want to hear about. So we've got the prison, hopefully, coming as one of our next podcasts. And actually, we also have the Bright charity coming to an NPC talking about pilots they've had where we look at people's financial needs. And for me, that's a really interesting project because we know that sometimes people struggle with their lifestyles and how they're managing at home, and that ultimately impacts their health as well.
Yeah. All very exciting.
Yeah, it's very exciting. I think we're really engaged as a team, aren't we? And we're always very positive and feel really sort of invigorated for the future and seeing change.
We are, and just to emphasise your point, we're really keen to hear comments, ideas from anybody. We really do value them. They add to the project. So do contact us via the means that you've described. It's really important to us.
Great. So thank you very much for listening. Hopefully you found that interesting and it's updated you on where we're at. But if it hasn't, or you've got questions, please, as Eliot says, feel free to contact us.
Thank you.